Hi, everyone, and welcome to our final and amazing webinar for Lipedema Awareness Month. This is Lymphopress's celebration of a condition that is far too often untreated, undiagnosed. We are a company that cares about lipedema all year long, and we are proud to have provided a series of webinars on the topic. Today's is especially great with one of my favorite people, and yours too, because you know that Karen Ashforth is a renowned expert when it comes to fibrosis. She's going to be speaking today on how Lympha Press addresses pain, fibrosis, and swelling in lipedema. So I want to encourage you, please, to put your questions in the Q&A. Feel free to say hi and tell us who you are in the chat portion. We'd love to know who's watching today. Again, it's going to be a terrific, close to an hour presentation. We'll have time for your questions at the end. So without further ado, Karen, do you want to bring that PowerPoint up and let's get this started for Lipedema this month?
Thank you so much, Brenda. Oh, it's so great to be here. So I am just sharing my screen here, and we've got a lot of information today. So I'm going to go a little quickly, but I want to give you some great tools for your toolbox. I'm going to be talking about a lot of fibrosis techniques in addition to Lympha Press, but then of course we are definitely going to talk about some tips and tricks and ways to use Lympha Press to help to treat pain, fibrosis, and swelling in lipedema. So without further ado, I would like to start by just giving you a little agenda of what we're going to talk about. So we'll start with just talking very briefly about fibrosis and what causes it, some of the different types of fibrosis occurring with lipedema and lymphedema, because many people with lipedema also have lymphedema, and they have some of the lymphedema related fibrosis conditions. So I want to just give you a little overview of that. Let's talk about fibrosis prevention and management. And then lastly, one of my passions, which is how Lympha Press can really help you treat lipedema, lymphedema, and fibrosis. So fibrosis, in a nutshell, is when healthy tissues become hard and thickened. And the cause is always an inflammatory process. There's many different types of fibrosis, but the common denominator is inflammation. Fibrosis can create pain, restrictions in movement, strength, and function, and it damages tissues. It damages lymph and blood circulation, and it increases the risk of swelling and further fibrosis. So this is a very, very, very important aspect of treatment because there's a lot of prevention going on here. Stanley Roxon just published a paper about lymphedema, and he made a very interesting statement that I love. He said inflammation and fibrosis are intertwined. And I really honestly do believe that, because I see a lot of patients, and some of them develop severe fibrosis, some of them not so much. And inflammation is really the factor that drives fibrosis, creation, severity. So it's an important thing to consider. And when we look at the vicious cycle of inflammation, it can contribute to fibrosis, which then impairs lymph drainage, which creates more inflammation and more fibrosis. So this is an important thing to keep in mind. Now we're going to talk a little bit about the lymphedema stages before we get to lipedema. And the stages are driven by fibrosis. That's how they're defined. So even in the latency stage, where there's no visible or palpable swelling, there are still fibrotic tissue changes that are starting. And when we get to stage 3, it becomes very severe in terms of the amount of fibrosis and the damage from fibrosis. So this is just a little visual for lower body lymphedema, so you can just see what the stages look like. These are some of my patients, and starting at the left, stage 0, there's no visible or palpable swelling, but fibrosis is already occurring. And by the time we get to stage 3, there's a lot of extra tissue, and we can reduce somewhat, but we can't get rid of the extra tissue with standard clinic lymphedema treatment. Lymphostatic fibrosis is what we're talking about that's present in all lymphedema patients, and it forms from the lymphedema swelling. It's an inflammatory process, and over time, the high protein lymph fluid attracts fat cells, and the tissues become thicker and denser, and it is progressive. Now, this is a slightly different type of fibrosis than we see in lipedema, but I believe that the two can occur when there is swelling present in lipedema. So I wanted to just give you that heads up. And you can see on the right, the pictures, the arm and the foot, how there is swelling present, but there's a lot of extra tissue that will never reduce. So we really want to prevent this. We want to keep it softer, keep the circulation going. And I'll talk about that more later in the talk. On the topic of lower body fibrosis, in addition to the lymphostatic fibrosis, you can see on the right, this is someone with chronic venous insufficiency or phlebolymphedema. And you can see that this is a condition that often happens at the same time as lipedema. So I wanted to just talk about this because there's a number of different types of fibrosis that you can see in this picture. So the lipodermatosclerosis is present because you can see the inverted champagne bottle legs where you have the tiny ankles and the big calves. And so there's actually scarring tissue around the ankles that's creating a tight band. Dermal fibrosis is something that occurs in all different forms. It can be tiny little mossy patches to big wart-like growths. And this is because the circulation is impaired and the skin is not getting the correct nourishment or the decongestion that's needed. On the right-hand side of the picture, this is this lady's left leg. You can see a white patch in the middle of her lower leg, and she had cellulitis there. Some of you may have had cellulitis infections, and if you do not decongest the area properly afterwards, all the infectious wastes and the white blood cells that come in to fight the cellulitis can form a plaque. So you can actually see it's a different color. And that is a very, very hard area. And it is very possible to get it softer and to increase the circulation. And that's an important thing to do because it can cause recurrent infections if you develop those plaques because it really limits circulation in that area and makes it harder for the body to take care of bacteria. She also has had wounds, and so she has wound bed fibrosis that forms around the wounds that are slow to heal, and that can also create a similar type of hard fibrosis. Other things that can cause fibrosis in the lower legs or even the arms are surgical or surgery or trauma, radiation, and then post-thrombotic syndrome is where there's been a blood clot and there's extra tissue that forms around that because the circulation's impaired. So now let's just whiz on to upper body because again, some people with lipedema also will experience upper body lymphedema that is in addition to the lipedema. So you can see the stages starting at stage 0 where there's no visible or palpable swelling and on to stage 3, which is different from lipedema. You can see that the entire arm and the hand are affected, but sometimes we get both. So let's try to prevent that. And some of the common types of upper body fibrosis that I see in my practice, in addition to the lymphostatic fibrosis that we talked about, are, and you can see some of these in this picture, a surgical scar, and this is a fairly keloid scar. This is a hard, painful scar. This is not a happy camper. And then you can also see the tissue discoloration around that where she's had radiation. We won't see this in this picture, but cording is something that can be a problem in the upper body, particularly after breast cancer surgery, and it can develop typically in the armpit. It can run from the armpit down to the hand. It can run from the armpit down the trunk, and it can be painful and restrict motion. Seroma fibrosis is basically something that can occur anywhere in the body. Typically after a surgery, if there's a pocket of swelling that doesn't reduce, it can create this little puffy area of swelling and eventually harden up. So it's really important that if that occurs as a complication of surgery, that get addressed right away. Fat necrosis, which is basically where fat dies. And we see that in patients that have had breast cancer and have it's a fat transplant as opposed to an implant to reconstruct breasts. And sometimes not all the fat comes along for the ride, and it can turn into bumpy, painful little areas. You can also get wound bed fibrosis and post-cellulitis fibrosis in the upper body. So this is just a very whirlwind tour of upper and lower body fibrosis. And now we're going to go on and talk about lipedema-related fibrosis. So when we look at the different stages of lipedema, and some people describe it in 3 stages, some people in 4, we start, if you look at the top line and just follow it across, in stage 1, we've got a flat, smooth skin, but in stage 2, it becomes irregular texture and even a mattress phenomenon where we have a lot of variation in the terrain of the skin. By stage 3, the skin is very deformed. The tissues are very bulky and heavy. When we look back at stage 1 at fat layers, we've got a thicker fat layer than normal in stage 1 with lipedema, and it continues to thicken through the other stages. And also in stage 1, we typically can see nodules in the fat, and I'll be talking about that a little bit more, but they start out rice to pearl size, and then they grow larger to the point where they can become very large masses and even lobules. So I know that that the risk for lipolipedema is something that is mentioned in stage 3, but honestly, in my practice, I've seen it even in stage 1. So I think maybe because it's not as obvious, but I think that there's a lot of prevention that can be very, very helpful in terms of avoiding the progression of lipedema. So this is just a visual in terms of the stages of lipedema. And as you can see in stage 1, we've got the smooth skin with the thickened fat layer. And you will see some nodules in a minute. Stage 2, you can see that things are getting very thick and very irregular. And then by stage 3, we've got a lot of extra tissue, and it becomes very burdensome to even stand or walk. So let's talk a little bit more about the types of fibrosis in lipedema. And the 2 I'm going to talk about today are SAT, which stands for subcutaneous adipose tissue fibrosis, or nodular fibrosis. So we're going to start with SAT. And this is caused from, yes, inflammation. We've got inflamed fat. And so it starts to create dense fibrotic fatty tissues from the inflammation. And this is a very specific process to lipedema. It can affect the skin, the bones, the muscles, tendons, and ligaments. So this fat can cling on to a lot of other structures, and it becomes a vicious cycle because the inflamed fat starts to create fibrosis, which increases the fat tissue, which then creates more inflammation, and it's really a mess. So the subcutaneous adipose tissue does block lymph and blood circulation, which starts to create more swelling. It compresses nerves, which starts to create pain. So this is something we want to really stay on top of. The other type of fibrosis we see a lot in lipedema is the nodular fibrosis. And these nodules are created by the inflammatory process of lipedema, where inside the SAT, we get these little nodules of fat, but they're hard. And they can start out really small, the size of rice. They can get to the size of walnuts, apples, even larger, and they can clump together into very painful lumps. And this is something that I hear a lot about, where there are nodules that when people are trying to lay down and sleep, especially in the legs, that the weight of the body on the nodule can make it hard to sometimes sleep on a particular side. So this is something we want to really address so people can get better sleep and have less pain. Some of the clinical tests that I wanted to share with you that look at tissue extensibility and fibrosis are described here. So the pitting test, which we tend to not see unless someone has an overlay of a lot of swelling on top. So when there's a lot of fibrosis, it's not pitting. But if it's fibrosis plus swelling, then we can see a little bit of pitting. In the middle, it's the Stemmer sign. And the Stemmer sign is the ability to lift a skin fold on the second finger or toe. And it can be positive either because there's a lot of swelling or because there's severe fibrosis. Tissue extensibility is looking at the ability to move the surface tissue around. And if there's a lot of hardened fibrosis, it's difficult to do. It can also be difficult if there's severe swelling. These are all clinical tests, but as you can see from my descriptions, it doesn't necessarily address the quality of the tissues. The inability to pit or lift folds of skin or move tissue around could be due to either fibrosis or swelling. So ultrasound elastography is something that is emerging as a more definitive test. And here you can see in the red circle is what Dr. Emily Eicher calls a dancing fascia line, which we commonly see in lipedema, where these lines of fascia are broken. And we have been able to track patients and see changes in the quality of the tissues. I also want to direct your attention to the colored part of this slide. And in elastography, we can actually see different colors that represent the density of the tissues. So the more red color is a harder part of the tissue than the blue. That's more flexible. There might be more fluid in there. So this is a very interesting test that has a lot of promise to track fibrosis. It's not available in the typical clinic. It's very, very specialized, but it's something that I think we're going to be hearing more and more about. So, oh my gosh, what to do? Let's see if we can prevent fibrosis from progressing, because first off, if we can lower the inflammatory load, that's going to go a long way. Lowering the body mass is going to help a lot with inflammation. And we know that higher body mass is the #1 risk factor for lymphedema, but it also worsens lipedema. We want to make sure that people are performing regular decongestion, because fibrosis forms from stagnant, inflamed tissues. So by decongesting, you are helping to prevent fibrosis big time. And then when you have fibrosis, let's look at addressing it with some of the antifibrotic modalities. So here are the 4 different aspects of fibrosis treatment I'm going to discuss today. And there are more, but oh my gosh, we just have such a short time. I want to hit the high points and give you a lot of useful information. So we're going to start with manual therapy. And in manual therapy, there are a lot of techniques that qualified lymphedema therapists are able to do in the clinic. And then there are other techniques that we can give people to do at home. So this is just a little menu of some of the things that I offer in my clinic, and we're going to talk about a few of them. So these are some alternatives to manual lymphatic drainage. And I learn about these from my patients. That's where I got the paint roller idea, because some people have trouble reaching, especially all the way down to the ankles and the feet and the toes. So the paint rollers are brilliant because they're soft and they also have something you can hang on to. So if someone has hand problems, this can be really, really useful. The rolling pin, I would put some padding on it, but that's something that can allow some deeper uh, tissue massage in the direction of lymph flow. And vibrators, we'll talk about those a little bit more later, but I love using vibration for fibrotic tissue because it's so effective. It's such a time saver. It's so easy on the hands. And dry brushing, I haven't had great results with this. And I think part of it is because the lipedema tissue is so thickened. And the dry brushing is really designed to help the surface lymphatics. So I added it because it's commonly mentioned as a treatment, but I think that for people that have more fibrosis, it may not be as effective and you may need to use more pressure. And we will talk about pressure in a minute. Let's talk about getting some traction on the skin, because when you put a lot of pressure on the skin, sometimes with lipedema, there is pain. So I like to be able to move the tissue around without having to press so hard. It also makes it easier on the hands. So these exercise bands, Dysum, which you can actually find on Amazon, it's a non-stick medium, or even easier are gloves that have these wonderful non-stick surfaces. And gloves, I think, are my current favorite in terms of being able to really grip the tissues and help to move them without pressing as hard. So all the different techniques with MLD and other techniques that your therapist may have given you, I think they go even better when you've got something that helps give you more traction. Next, we're going to zoom on to modalities. And again, I have a lot of modalities that I use in my clinic. And I'm going to give you the caveat that unless you have specific training, I don't want to encourage you to try any of these. If something kind of tickles your fancy, talk to your lymphedema therapist and see if you can get more information about how to tailor that to your situation. On the bottom, I get a lot of questions about body sculpting and thermotherapy for lipedema. And my experience with my patients is that it helps some, it doesn't help others, and that it tends to not last. So I don't know, there's been some scholarly research about it, but I don't know that anyone has looked at the long-term effects. It is expensive. So that's what I have to say about that. We'll talk about a few of these modalities, and starting with positive pressure. So I use instruments a lot in my clinic, but I want you, again, to get guidance if this is something you think could be helpful. This is a technique that we stole from the Chinese called gua sha, and it is fast track for working with thickened tissue, with stuck tissue, even with nodules, and it can be done very lightly. So it's something that I want to just throw out there as a technique that is a big one in my toolbox. Likewise, using soft therapy balls. They're great for trigger points and tight muscles, but they can also be used with nodules and inflamed SAT. This is a little gentler. We're not talking tennis balls. We're talking balls that have a little bit of give to them. Negative pressure is something I use extensively, and it is very aggressive. it should be used with guidance. What it is horizontal and vertical stretching that creates external pressure that's lower than the internal pressure. So it makes the tissues lengthen mechanically, and it actually activates fibroblasts, which help with healing, and it facilitates the uptake of fluid in the initial lymphatics. So it has a decongestive effect as well. These are some ways that I use negative pressure. There are pumped cups, which are real easy to use, but can be very aggressive. Silicone cups, which are a little gentler. And then there's even mechanical suction devices, which are very expensive and pretty much just used in clinics, but you can really regulate the amount of negative pressure as well as add other features that can help a lot with fibrosis. Elastic taping is another modality that can be very helpful in lifting tissues. It helps to increase lymphatic circulation, and it can really help a lot with scarring and other types of fibrosis with nodules. I've used this as well as SAT, and the downside is that you have to keep using it, but it can create some progress and I think help people slowly. So this is something worth getting guidance in terms of using. Vibration is a biggie in my clinic, and we use handheld vibration, not the Hiva mat, but I use a lot of wand vibrators and mini vibrators. I include the Hiva mat because many clinics do have that, and a lot of people feel a lot of relief with that. But even more importantly, I love using whole body vibration plates, and these platforms are for more than just standing on, because some people feel that it's a little bit tricky to be able to keep your balance, even with one that has handles. So I will often recommend that a patient sit on a bed or some other surface where they're not having their back supported. So you're just kind of sitting in a relaxed position with the plate on the floor, and the feet go on the plate, and it can create a vibration that can go throughout the entire body. My caveat with whole body vibration is that for people who have blood sugar issues, it can create a lot of muscle contraction because you're stabilizing your body against this movement of the vibration. And we have actually had patients have blood sugar issues who haven't been used to that much exercise. So I would say that using vibration, I start with 5 to 10 minutes and then work up to 20 to 30 minutes. And I love to multitask with the whole body vibration. You can do manual lymphatic drainage, you can do anti-fibrotic techniques. There's all types of different things that you can do at the same time where the vibration just increases the effectiveness. So I know that this is very popular with lipedema, and rightfully so. I've included a little study. Schneider 2018 was specifically for vibration plates and lipedema. So that's an interesting study to check out if you're so inclined. There are a few studies about lymphedema and vibration, but there's a lot more research that needs to be done in this area. So a lot of people ask me, what is the right type of frequency? What's the right type of plate? And all I can say is that because there's not a lot of hard evidence about what works better than something else, you can get a vibration plate for a couple $100. You can spend thousands of dollars. So I think because we don't have any definitive evidence that's telling us what's best, I would just go with trying something out if you can, and seeing how it works for you, seeing if you like it, and going with if there's one at the clinic that you can try, or at a store that you can try, or if you can get a money back guarantee, that would be my suggestion. Because rather than spending thousands on something that you're not sure about, it might work just as well, something that is less expensive. Now we're going to talk about compression garments. And I think that compression is an area that can really help fibrosis. So we're going to talk not only about garments, but also about pads, which can help some of those nodules. So these are some of the different types that I use with lipedema: elastic and quilted compression. I use a lot of textured micro massage garments, and there's advantages of the low profile garments versus the bulky compression. Um, but the effects increase when you add bulk or exercise. Class is just the amount of compression and then external pressure. So I would say that an ideal thing would be to have someone who is using quilted compression at the same time they're using Lymphopress, because the two together give a double massage, which is very, very effective, I think, especially for lipedema. So let's go into some more specifics here. You have probably seen some of these textured circular knits that are not medical grade. And for people who have smaller body parts, this works great. But when you start getting bigger and have lobules, I steer away from these because the thin elastic can migrate into the crevices in lobules and joints and create skin breakdown. So be very careful about this. That's where the custom flat knit garments really come in handy, because the flat knit is anti-fibrotic, but it's thicker and it's made specifically to contour to an individual's body. So I would say if you're in stage 2 or stage 3, you're probably looking at the custom flat knit. Early stage 2, maybe you can get by with the textured circular knit. So that's my opinion on that. Again, to recap, the main advantage of elastic is that it is lower profile and you can be more functional. I'm just going to throw out some names of some of the non-medical grades: Solidea, Bioflect, Caesalis, and even anti-cellulite garments. So if you did an Amazon search, you could find all kinds of things because there's new ones popping up all the time. My experience is that Bioflect gives a wider range of sizes. In terms of the custom flat knit, you can get a class 1 to 3 for the upper body and 1 to 4 for the lower body. So you can get a lot of containment with that custom flat knit. Now we're going to talk about quilted compression, which is not low profile. You have lower profile with noodle foam, channel foam, or orange foam, but it's not the same as something elastic that conforms to your body. You can get something bulkier, which are the chip foam pads or garments, and the cherry pit pads or garments, which you may or may not have heard of. Something that I developed back in 2009. I did a little study and presented it at the International Congress in Australia, and then published it in the British Journal of Lymphedema. And I found that the cherry pit pads were especially helpful with the harder fibrosis and scar type fibrosis. So this is something that I really caution people to try carefully, because it can be aggressive, it can be painful. So you want to try it for a short period, say 20 or 30 minutes, and then look at the skin, see how things are feeling, and then maybe try it again. It's something that can be very effective, and you want to have a little compression over it so that it does have more effectiveness. I do sometimes have patients that use it with pneumatic compression, but you want to do a trial under a compression garment first before you go to higher levels of compression. I don't use waffle foam because you get a flat tire. And things that can increase the anti-fibrotic effects of quilted compression are bandaging, Velcro wraps, even elastic compression, and then of course pneumatic compression. So I'm going to show you some examples. And here are just some garments that you can just slip on easily. And then there's also pit pack garments. So you can get garments in either the chip foam or the pits. There are different pads out there that you can put in spot areas. And now I'm going to talk about some homemade do-it-yourself. You can create little channels in foam, which Irregular surfaces are what stimulate both the circulation and the fibrosis softening. The spaghetti foam or noodle foam with a gray foam layer can be great for directing fluid as well as helping to create a massage to the fibrosis. And then there's commercially made chip foam strips. You can actually even make your own pads with a paper tape with little chunks of foam cut up inside. And then here's a cherry pit alternative that is kind of low tech and temporary. I'll do this just to see if someone can tolerate it. So I'll use beads inside a paper tape and create a little pad. And this is gonna, it's not going to last more than a few months. It can be washed very carefully, but it will just kind of dissolve and go bad after a little while. But it's a good way to test whether this is something that's going to be helpful and whether you want to buy something commercially that is quilted in fabric that you can wash and use for a long, long time. All right, now we're finally getting to Lymphopress. And pneumatic compression, I think, is one of the most powerful tools that anyone with lymphedema or lipedema can use because it does so many things. It decongests, it creates an anti-fibrotic type of massage. And so for many of my patients, this is so useful. So let's talk a little bit about some of the evidence, because many people, especially therapists, for some reason, are not necessarily educated about what pneumatic compression can do. So I'm going to just give you 4 studies that were done specifically with Lymphopress equipment, and 2 of them specifically for lipedema. So the first one is looking at lymphatic function in the lymphedema affected extremities. And some of you have seen this video. I was actually very honored to be a participant helping with this study, but you can see the imaging is showing this lymph function while the patient is receiving pneumatic compression. So the pneumatic compression sleeve was a special clear sleeve that was made just for this, and we were able to find increased lymphatic uptake during use, but also after use. And we only looked for an hour afterwards, but I think that the reports I get from my patient is that there's carryover that can occur sometimes even for days. So this is a great study that looks at lymph circulation. And moving on, we've got another study that was done showing how Lymphopress is as effective as MLD in treatment for lipedema. So this is something where it is a cost savings because Lymphopress is covered by so many insurances, whereas MLD insurances tap out after a while. It also showed the safety of Lymphopress as a treatment for lipedema. We also have another study with Lymphopress that showed how it decreases the capillary fragility in lipedema. And this is interesting because this helps to decrease hematoma, which is bruising, which is a big problem for many, many people with lipedema. It also helps to reduce the limb volume and diminish persistent lymph or lymph stasis and soften fibrosis. It also increases venous flow and tissue oxygenation and improves mobility. Here's the biggie: pain, which is something that I hear from so many of my lipedema patients. In this study, Lymphopress actually was shown to decrease the perception of pain. It also, and this is an area that I'm really interested in, it increased venous return, which has different effects on the heart that lead to autonomic regulation and endorphin production. What does that mean? A lot of people have heard about the autonomic nervous system and how we have a fight or flight component, and we also have a calming component. And almost every one of my patients who has ever tried Lymphopress falls asleep because it's so relaxing. And endorphins are the body's natural painkillers. So getting something that is non-pharmacological as a way of decreasing pain is very valuable, because many of the medications that decrease pain often have side effects that increase swelling. So this both affects pain, swelling. The endorphins are our happy hormones. So this is something worth looking into. All right, let's talk about pressure, because many people have questions about how much pressure do I use? And my answer is the amount that is comfortable, because there is a wide variety of pressure that's available with Lymphopress treatment. And I use the illustration on the right because some people are scared of pressure. But Lymphopress, you can only go up to 90 millimeters of mercury. And that's the same amount of pressure on your feet as if you were standing in 4 feet of water. So I would say that even if you're using 20, which is a low amount, you're still getting benefit. And the higher you can go with comfort, the more it will help to decongest and remodel fibrosis. And so that's something to keep in mind. Many therapists are actually a little bit scared of pressure too, and that's a whole other lecture. But I wanted to just include this slide to kind of demystify the idea about pressure. Don't make it hurt, but make it effective. So I also get questions from people about what are the differences between different pumps and how they work. So you can see on the left how we are getting 2 chambers active at any one time. So once we've left the feet, the wave of pressure is moving upwards. And this wave-like action is called peristaltic programming. And it's a lighter treatment because it's not holding on to all the chambers, as we'll see in the next slide. I would say that this is a great choice for people with lipedema with mild fibrosis, and it also allows more tolerance for proximal or pressure that is closer to the hips and the buttocks and the abdomen. So what I find is that with this mode, I can use more pressure overall because it's more comfortable. Now, in contrast, we also have the sequential programming. And this is a program that you can see as the pressure is moving up the body. It holds on to the feet and the lower legs, so everything is getting compressed all at the same time. That's what I mean by sustained distal pressure, is that it's holding on the farthest part of the body. So this could also apply to the hands and arms for that matter. So this is definitely more intense. And when I'm using sequential programming, I always start with the very lowest pressure. This is a very good programming for people who also have phlebolymphedema, because it is addressing that lower leg swelling, and it creates a sustained pressure that prevents reflux and dermal backflow. It's very aggressive for fibrosis. So if I have someone who has a lot of body mass, a lot of fibrosis, I may recommend sequential over peristaltic just because it gives you a little more bang for your buck. But if someone uses sequential and it feels a little bit too much on the feet, but just right everywhere else, I will pad the feet to increase comfort and disperse the distal pressure. So I use quilted garments, towels, shoes, slippers, and even Crocs, just to kind of create a little bit of padding around the feet so that the rest of the body can tolerate, more pressure without it being uncomfortable at the feet. It's also possible to block the foot chambers on this. So let's talk specifics. We are doing bilateral treatment because lipedema is a bilateral condition. So if we have someone who has upper body, we use the Lympha jacket because it treats both sides at the same time. And this is a wonderful treatment that is very efficient and comfortable. And so for someone that has lipedema in the arms, this is the treatment of choice. We have treatment for the lower body, including the abdomen and the genitals. And there are not a lot of pumps out there that treat the genital area. And Lymphopress has, in my mind, the best system because you can use either peristaltic or sequential action and a pantsuit at the same time, which is unique. No one else has that. So you can see that this is going to give you a very comprehensive lower body treatment. For people of size, anywhere from 330 to 700, using the Lymphopod is very, very effective. And I've actually been in the Lymphopod. I'm 140 and I got a great treatment. And what's unique about the Lymphopod is that there are chambers on the insides of the legs, which really address the lobules that are common. And because of the irregularity of the body shape, other pneumatic compression just does not have the same effectiveness in being able to create the massage for the lobule areas in the insides of the legs. So Lymphopress has knocked it out of the park again with this one. And it's a wonderful, wonderful treatment that can really be very effective for people in stage 2 and stage 3 lipedema. So I just want to make the argument that not all pumps are equal. Many pumps have very limited programming and pressure ranges. A lot of pumps have a long cycle time and a short pause time. So you're getting squeezed for a long time without release, and that can create pain. Many pumps only treat the arm or leg without an option for the trunk or the abdomen. And many appliances are difficult to put on. They don't fit well, they're uncomfortable. Some are chap style. So for hygiene, because they're not very cleanable, they avoid the genital area. And those garments can actually contribute to genital edema because they don't compress it. Many pumps have very limited deflation, and that can create a tourniquet effect, which increases pain, and it's not as effective for moving swelling. Many pumps do not have overlapping chambers like Lymphopress does, and that creates an uneven pressure, which is a very I think, important thing in pneumatic compression. When we bandage, we are overlapping the bandages so that we're getting a smooth, even pressure that can help to move fluid. So that's a feature that I think Lymphopress has that is not a common thing. You don't see it in other pumps. So in a nutshell, Lymphopress decongest swelling. It has the capability for higher pressures to soften and remodel hardened tissues, but it can also go low if need be for pain. When we have softer tissues, we have less obstruction to lymphatic circulation and increased spontaneous circulation, which leads to better management of lipedema, lymphedema, and fibrosis. So I am going to stop screen sharing because I would love to take your questions. I just, educating is something that is so fun for me. And I see we have a few questions already. So Brenda, yeah.
First of all, you mentioned that Lymphopress hit it out of the park. Karen Ashforth, you just hit it out of the park. That was so rich with information. Many people have asked, will I be able to see the replay? Absolutely. As soon as we get the edited video, we're going to post it on our YouTube channel, and everybody that has registered will receive the link as well. And before we go into the really good questions, I do want to do my really good commercial, which is to say that pumps have got to be easy to use for someone to use it. And we hear over and over again from the patients we work with that Lymphopress is easy to use. You slide in, someone uses the word shimmy on in, zip it up, hit start, and your therapy begins in the comfort of home. We would be honored to work with anybody who's on today's webinar or watching the replay and help you get what we consider to be the optimal therapy for lipedema patients. We were the first device, the Optimal Plus was the first device cleared in the United States for the treatment of lipedema in the United States. So we are experts, we care deeply. And with that, I'm going to get to some of these really good questions. One of which is from Teresa Payne. Hi, Teresa. We're so glad you're out there. Karen, she asks, will pneumatic compression aggravate or worsen AFib?
Oh, that's a great question, Teresa. And before I answer any questions, I want to just say that because I haven't had the opportunity to do individual assessments, I'm going to be giving general information. So all of this information that I presented today, including in the Q&A, all of this information is general. And so I don't want you to take anything as specific medical advice. But having said that, atrial fibrillation is not a contraindication for pneumatic compression. So I would say that it really would not be something that I would be concerned about as a therapist, but you may want to consult with your doctor to make sure that there isn't anything else going on cardiac-wise. But AFib, not a problem.
Excellent. There was a lot of interest around your discussion of vibration plates, Karen. And so Nicole Scheiman says, first of all, very informative, and thank you very much, Karen. She wants to know what you recommend for the duration and frequency for a vibration plate use. And what are your thoughts on the use of a mini trampoline? And to support what you've said, we're not giving any direct medical advice, but in general, how would you answer that question?
Oh, that is a great question. Thank you so much, Nicole. So I would say in terms of frequency and duration for the vibration plate, I would start out at once a day for 5 or 10 minutes because we don't know how it's going to feel. And some people use it more than once a day. But I would just kind of go with how it feels, what effects are you having. You may want to consult with your lymphedema therapist about this. And as far as mini trampolines go, I think any kind of exercise is fabulous for lipedema and lymphedema. And there's a lot about mini trampolines because it's something that, you know, moves the body, jiggles the body. And so if that is something that you love to do, it would be great. But I don't think that mini trampolines are the magic bullet. I prefer vibration plates over them because I think that there's more of a chance of injury with the mini trampolines. So that's just my feedback on that. I think they're great, but you know, it just depends on what works best for you.
That is a really great answer. And going right along with it, our friend Judy Green. Hi, Judy. We're so glad you're out there today. She wants to know if she has back issues. Would you say avoid even the vibration plate?
Oh, you know, vibration plates actually can help treat back issues. So I think it depends on the back issue. And if it's something that is, you know, real serious, you may want to talk with your doctor about vibration. But a lot of people who have back issues because of tight muscles often find that there's a lot of muscular relaxation with vibration plate. I own two. So I use them at home and in my clinic. And, you know, my experience with both myself and my patients is that it can be very relaxing. Now, having said that, if you have back issues, I wouldn't start by standing on the vibration plate, because that's going to increase muscle contraction because you're having to keep your balance. So I would say for someone with back issues, I would really start with the vibration plate on the floor, on the feet while you're seated.
Great advice, and surprising for someone who might think it could exacerbate a back issue. It can actually possibly help. Always you recommend listen to your body though.
And talk to your doctor if you have a medical condition. I mean, there's certain back conditions where, you definitely would want to get doctor's clearance before trying this.
You spoke beautifully and gave the visual of the pressure that is in a pool of water to sort of eliminate fears about pressure. We had a really great question from Keith Moore out there. Keith, we're glad you're with us today. He wants to know what the appropriate pressure would be for the treatment of fibrosis. Am I correct in stating you need to have a certain amount of pressure in order for it to even be effective at all?
Well, that's a really interesting question. And I think that it really depends a lot on how thick the tissues are. We know that anyone with lipedema or lymphedema is, by definition, they already have fibrosis and the tissues are going to be thickened. So rather than give you a specific number, I'm going to say that it will depend on two factors, actually three. The most important factor is pain. So it needs to be very, very comfortable. It should never cause discomfort. But the other two factors that I take into account are the thickness of the fibrosis and the density of the body mass. So somebody who weighs 300 pounds is going to need more pressure to be effective compared to someone who weighs 100 pounds, just because the tissues are denser. And then when you add fibrosis on top of that, depending upon the amount of hardness in the fibrosis, people who have very, very hardened SAT are really going to benefit from higher pressure. But because it's lipedema, there can be pain involved. So it's a little dance. And usually in my clinic, I will start with the lowest pressure possible with someone with lipedema. So I'll start with 20 and get someone used to it. And then we'll start to adjust the pressure upward and watch the comfort level and see, okay, are we getting a better treatment? Are we getting less swelling? Are the tissues softer? So Keith, I'm not giving you a cut and dried answer because it's really different for everybody. And that's why Lymphopress is so great, because we have such a versatility of pressures. We can just target in on any given moment on what the right pressure is going to be for that person that day. And we can just keep changing it as the person's needs change. I will say that I have patients who lose body mass and they get softer fibrosis, and then we start to turn the pressure down. So really, it is such an individual thing.
I love the way you phrased that. Every body is different. Everybody's different and every body is different. So that was excellent. We did have a question come in, and I almost want you to bring up your slide again about how not all pneumatic compression is created equal, because while the questioner mentions a competitive product, and we would never disparage anything else that's out there in the market, we can speak to what makes Lymphopress different and why the therapy is so effective. You just stated one point right now. The other components that come to mind that make the Lymphopress unique and different is the ease of use. Easy to clean, especially a lot of people have wounds and you can just wipe this down. It is so easy to clean. The overlapping chambers are another unique feature, but I'm actually answering the question when I know you could do a far better job than I could. What makes the Lymphopress unique as compared to some other products, which we will not mention by name?
So first, I want to say that I want to be educated about everything that's out there that people can possibly use. I really want to know the features of other pumps because I want to know if they are going to be the right thing for an individual patient. So I feel like I'm speaking from a place where I have worked with many competing products. And I will still say that Lymphopress really has it all. I think that when I look at competitors and products that are marketed towards lipedema, I'm not seeing the genital compression. I'm not seeing the ease of putting it on, as Brenda said. I'm not seeing the ability to clean it. And to me, that is a huge thing, is keeping my equipment clean. I'm not seeing a versatility in the ability to change the pressures in a big way. And I'm not seeing the ability to change the settings on the device. We saw the difference between peristaltic and sequential, and how some people really need the sequential and some people do great with the peristaltic. So I think that those, kind of in a nutshell, are some of the answers that I would give. If I'm looking at competing products, do I have patients with other types of pumps? Yes. Do they work differently? Yes. And sometimes I have to do a lot of modifications to get them to work properly for the patient. And sometimes the patient and I will just say, oh my gosh, let's just start over again. So it depends on the individual person and the need. So I think that's I want to leave it at that.
Well said. Absolutely. And thank you so much. And I would check out the replay too. That one slide about not all pumps are created equal really said it all so beautifully. I would say also that it's not just the product that you're getting. We have such an effective pneumatic compression device, particularly the Optimal Plus, which is indicated for lipedema. But we also have a whole team of people that care about the lipedema patient. We do roundtables every month for the lipedema community. You can go to our website, lymphapress.com, go to the lipedema prompt, and it falls down to videos. You can register for our monthly roundtables or see the dozens and dozens and dozens of interviews that I've been blessed and privileged to do with other lipedema patients who have seen reduced pain, increased mobility, fat pads eliminated. One woman lost 20 pounds of fluid in 1 month after using her Optimal Plus. These are not results that we can make up. And it gets us excited because aside from bringing effective change to patients physically, we're seeing hope come back into their lives. And I know that's where your heart is at as well, Karen. You care deeply about the patients that you treat. I will get to one more question. I know we've gone over time a little bit. This has been so good. Kelly Schlarman wants to know, Karen, how do you help patients with a burning sensation or burning sensations in their lower extremities?
Ooh, Kelly, that's a good question. And I think a lot of it depends on what's causing the burning. Where is the burning coming from? Because it's possible to have burning as a result of a local or in the area of the burning, you can have a grumpy nerve. But you can also get what's called a referred burning. So you can have the nerve compressed upstream at places like a joint or the spine. So I think it's really important to know, why is it burning? And there can be other things. There can be neuropathy as a result of a metabolic condition like diabetes, or as a side effect of a medication such as chemotherapy. So in my experience, I really find that I need to go after the source and figure out, why is it there? And if it's a neuropathy as a result of diabetes or chemotherapy, I found a lot of relief using compression, specifically pneumatic compression. But if I have a patient where it's obvious that it's a radiating burning pain that's going from the spine all the way down an arm or leg, then I would be referring this patient for medical assessment to see what's going on in the spine. And let's, look at where that disruption is coming from, and is there a medical treatment that can give some relief to that? So that's, I also have patients with numbness and tingling as well as burning, and same thing goes for that. It's like, where is the nerve grumpy and why is the nerve grumpy? But I will say that in a lot of cases, those nerves calm down. They are a lot happier when we're doing pneumatic compression with Lymphopress.
Someone once referred to it like getting a hug for your body. I don't know if that was you, or I just love that phrase. It's so good. I wish I could give you a virtual hug right now, Karen Ashforth, because that was an amazing presentation. I just put my email address in chat. If any of you are watching, maybe you're not using pneumatic compression and you're intrigued by what the Lymphopress could possibly do for you, we'd love to help. We would be honored to help. So please do give me an email. Shoot me an email at bviola@lymphopress.com. As we close out our Lipedema Awareness Month activities, Karen, is there anything you want to say as a note of encouragement to those who were kind enough to log on with us today?
Oh gosh. Well, I will say that in my nearly 20 years of practice as a lymphedema and lipedema therapist, that I have seen so many patients be able to put their symptoms in remission. And I think that Lymphopress has been a significant tool for many of these patients. I think each individual needs different combinations of these tools, but using compression, using decongestion, using treatment that addresses fibrosis, and also working on other areas of body mass reduction and other anti-inflammatory types of treatments, I think it's possible to make big changes. So if you're out there and you're struggling, there is hope. There is a lot of hope. And one reason why I'm doing this today is because I really feel that using Lymphopress can be so effective and give people encouragement and hope.
Absolutely. And I agree. I concur. I want to thank all of you who registered for today's webinar. Again, you'll be getting the link once we edit it and upload it to YouTube. We will continue. Look, Lipedema Awareness Month is important, but we care about lipedema all year long. So please stay connected with Lymphopress. And thank you again, Karen Ashforth. I'm applauding you. I think everybody else is saying thank you so much. And have a wonderful day, everybody. Thank you, Karen.
Thanks.
See ya. Bye-bye.